Hi, this is Jessica DeMassa. I'm at HIC 2017 in the HISA Studio here, and I'm with Frank. Frank, introduce yourself for everybody watching, please.
Hi everyone, yes, I'm Frank Smolenaers. I work at the Australian Centre for Health Innovation. It's based at the Alfred Hospital in the AMREP Education and Research Precinct.
So tell me a little bit about some of the projects you're working on right now.
Well, as an e-health innovator, I'm working on digital related projects. At the moment we've got one that's around digital wayfinding, so that's helping our patients and their visitors and carers find their way to appointments, to their clinics, finding their way to the nearest toilet, finding their way back to the car park where they park their car.
Oh, no kidding. Is that on their phone, or how does that work?
Yeah, it works on smartphones, Android and Apple smartphones. And basically they download the app and they can also scan in their appointment letter, has a QR code on it, so they can scan that within the app. It'll take them directly to where they need to go.
That's fantastic, because it's sometimes one of the most overwhelming parts about having to go to the hospital is to find where you need to go.
Absolutely, and what I like about it, we've really thought about the patient here. You know, when they get there, they're often running late. They might just have to find the conveniences, the toilets or the cafeteria. They're sort of hot buttons, takes them straight there. Can take them to their appointments and actually can help them find their way back to where they started. So, you know, in case they lose their bearings and can't get back to where their car is or the taxi rank.
Fantastic. What other projects do you have going on right now?
Well, there's another one really close to my heart. It's around sensory mindfulness. So this come out of our top 100 projects where we look at issues in the hospital with a team of the hospital staff go away and think about these things and how we might solve them. And one of the issues for instance, in the trauma emergency department is around patients that are very agitated. They're constrained while they're in a spinal constraint until they're cleared. They also may be coming off, things like drugs and or alcohol, or they might be just really frustrated that they've been in this accident and their life is changing, and there's all this mayhem around them in these busy departments. So what we're developing there is a portable cart. The cart is fully medical compliant and it'll have a large screen with actual content on it that will just relax and calm the person. There's different content for different purposes, but this will be kind of consuming their senses and hopefully distracting them from everything that's going on around.
What does that mean, consuming their senses?
Well, it's you could call it diversional therapy.
Okay.
So the idea there is to divert them from their thinking, their negative thinking, their agitation, and their aggression or their frustration, and actually let them think about more soothing and relaxing things.
That's fascinating. And now you had mentioned that this was one of the projects that came out of your top 100 list. So talk to me a little bit about that. What is that?
The Alfred take their top 100 staff away for an afternoon or so once or twice a year, and they have some motivational speakers and try to set the context, and then they'll start looking at some of the issues and but they bubble to the surface. They'll have a look at those and think of what they can do to maybe solve those, how they could make inroads. Obviously, huge patient focus around that. And then some of those go on to projects that are funded internally by the CEO to actually have quick, short pilots and try and prove the concept. And if it works, then it can go on to further funding and scale up through the organisation.
That's fascinating. What an interesting approach to innovation in a large organisation, really at the point of care.
Absolutely, and what is really great about it, I've been in some sessions here at HIC, which have been awesome, by the way, and one of those sessions was about what are the barriers to innovation, and this is really getting around one of those roadblocks. I think top 100 is also good, but we probably need the bottom 100. We need to look at it from the people at the coalface who have the great ideas as well, and try and grab some of those great ideas and foster those and promote those and fund those and have a mechanism by which they can go to fruition as well.
That's very well said. Well, thank you so much for joining us here at the HISA Studio. It's wonderful to get your perspective and hear about how the different projects you're working on and how you're driving innovation.
Oh, thank you very much, Jess.
Thank you so much. This is Jessica DeMassa here at HIC 2017.